Thank you. Hello, everyone. So one of the things that we benefited from with participation in the Texas Health Catalyst program and being one of the finalists is that it encouraged us to continue doing research, encouraged us to continue sort of refining our product and product concept, and also continuing to do sort of discovery with our potential users and customers. And so over the last 2 years or so since Texas Health Catalyst, we've continued to do a lot of work with clinical teams, including research, observation, and we've learned a lot of things. But one of the more interesting things that we've learned is that most clinicians tell us that when they have a patient in the clinic, they have a general sense or can develop a general sense of how that patient is doing. They have access to medical records, they have access to any kind of screener tool that they're using, and obviously they have the patient in the clinic so they can see and talk to them and get a sense of how they're doing. But when that patient leaves the clinic, things go dark. They have no sense of where this patient is, they have no sense of what this patient is doing, and we see that right as a problem space or an opportunity space to really help clinicians develop a much more sort of deeper understanding of the variety of factors that may be impacting health outcomes. So whereas they may have a sense of how a patient is doing, from our perspective, they have little to any understanding of what a patient is doing. And we know that those social, behavioral, and environmental factors are quite significant in terms of impacting health outcomes. So our product GoodRithms is really designed to sort of create customized and more advanced solutions for doing what's oftentimes referred to as remote patient monitoring, but doing that in ways that are customized to the clinical environment in which this application or product might be used in. And so here's some examples of how you might begin to use a product or a tool like GoodRithms in order to do what's oftentimes referred to as digital phenotyping, digital biomarking, which is essentially a way of sort of using mobile sensors, using mobile devices to basically do behavioral modeling, to give you sort of the signals and feedback to help you understand not only kind of what a patient is doing, how a patient is doing, but what a patient is doing. And so the variety of different ways in which these tools and technologies can be used to collect this data, to allow them to get access to proper signals and feedback. Again, all of these markers that could significantly enhance, significantly deepen their capacity to understand what a patient is doing and how they may be able to customize some type of intervention, some type of solution, some type of pathway to help that patient along their sort of recovery journey. So we're working right now, since our time with Texas Health Catalyst, we're currently working with 2 clinical teams to sort of test and pilot our product. One is a team located here at the Dell Medical School, the kidney transplant team. And imagine, for example, a patient after having received a kidney transplant, the significant amount of detailed follow-up that's required to sort of understand how that patient is progressing, whether or not, in fact, that patient is progressing towards a successful recovery. When we talk to the team, they have a variety of ways in which they try to do this, but ways that aren't necessarily efficient and ways that don't allow them to understand, again, those behavioral, social, and environmental markers that are certainly impacting outcome. When we ask them, for instance, what do you look for in terms of a successful patient, they say quality of life. And so what we've decided is how we could work with them to develop or customize our architecture to give them perhaps some type of quality of life score that might help them sort of prioritize or help them early predict when or if a patient is on path towards recovery. We're also currently working with a behavioral health organization. You can imagine, right, just the amount of demand that's currently on behavioral health specialists, right? In fact, what we oftentimes hear in the field is that we simply don't have enough staff and can't hire enough staff to respond to the demands for our services. And so imagine being able to have a tool that might allow you to be able to sort of remotely monitor patients, again, begin to identify those signals, those features, those biomarkers that may give you direct feedback in terms of understanding what a patient is doing. And so we're also scoping out a pilot with an organization that does this kind of work. Our sort of next steps is what we've been working on. We have 2 investment offers right now that we're currently assessing and evaluating. We are going to be working with Discovery to Impact to sort of develop a business plan and revenue model. And we're also continuing to do research and continuing to sort of deepen our understanding. We published a couple of papers sort of related to this work and are looking forward to further expansion of this opportunity. And here are just a list of some of the partners that we've worked with currently now or have worked with that have informed, developed our insight, and allowed us to really sort of understand what our vision might be and the kind of impact that we might have. So we're very thankful for Texas Health Catalyst and for the opportunity to sort of grow and sort of understand where we might have impact in this space.